Is the PowerPoint visible to you, to everyone?
Yes, sir.
Okay. So in last class we have discussed till to the manubrium part of the sternum, and in today's class we will first of all discuss the body of the sternum, and then Giffard process of the sternum, and then some clinical part related to the sternum, and also the ossification of the sternum. Okay. So without any delay, I am starting now the body of the sternum. Before I have showed you in the sternum the three parts of the sternum, isn't it? The uppermost part, see this one is the manubrium. This one is the manubrium, and this one middle part, the longest part, is the body, and the last part, this one is the Giffard process. Okay, this one is the Giffard process. So in the class of the manubrium last week we have discussed manubrium articulate with the body of the sternum to form a joint, and this joint you can see here. This one is the joint here. I'm drawing the line at the level of the joint between the manubrium and the body of the sternum. This joint is known as the manubrio sternal joint. Manubrio sternal joint, and at this joint there is formation of an angle. Here you can see this one is the manubrium, which is going in this way. In this way means you see the red line, it is tilting backward. If you see the upper side, okay, upper border of the manubrium, it is going more backward, and lower border of the manubrium is going more forward than the upper border. And here now you can see this one is the body of the sternum. See, upper border of the body of the sternum is going more forward, and lower part is going little bit backward. So this will make an angle. Okay, this will make an angle. Here you can see the two lines are crossed here at this point where there is formation of joint between the manubrium and the body of the sternum, manubrio sternal joint. Okay, and this angle is known as the sternal angle. Okay, this part also last time we have discussed. This angle is the sternal angle. Even I have told you the measurement of this angle. How much is the measurement? Some of you, can you tell? Its measurement.
160.
Good, very good. Its measurement is 163 degree. Okay, and after this, now come to the body. After this, below this, there lies the body. Okay, body lies still to the another joint. Okay, see, this one is the joint. Now in between the body of the sternum and Giffard process of the sternum, this joint is known as the Giffy sternal joint. Okay, the lower joint here, which I am drawing a red line. Okay, this joint is the Giffy sternal joint. Okay, Giffy sternal joint. It is given in the PowerPoint, its name. Okay, so the body extends from the manubrio sternal joint, till to the Giffy sternal joint. Okay, or you can also say from the sternal angle till to the Giffy sternal joint. This part is the body. Okay, and here you can read now the PowerPoint. It is longer, narrower, and thinner than the manubrium. It is broadest at its lower end. Okay, it is broadest at its lower end. Towards the lower part, it is more broader. You can see it. Okay, upper part, it is narrower than the lower part. Okay, upper end articulates with the manubrium at the sternal angle from the manubrio sternal joint. At this point already I have explained. Okay, after this lower end, see here, this one is the lower end. This point also I have already told you, even though I can repeat it again. Lower end articulates with the Giffard process. Lower end articulate with the Giffard process here to form a primary cartilaginous joint. Primary cartilaginous joint, and this joint name is Giffy sternal joint. Okay, this one is the Giffy sternal joint. Here it is written. Okay, Giffy sternal joint. And which type of joint is this? Primary cartilaginous joint. And sternal angle or the manubrio sternal joint is which type of joint? Secondary cartilaginous joint. So these joints, you have two types of these joints you have to remember always. Okay, here the clavicular nodes in the manubrium articulate with the clavicle to form the saddle variety of the synovial joint. Okay, and the first nodes in the manubrium in its lateral border in the upper part articulate with the first rib to form the to form the costo-sternal joint. Okay, to form the costo-sternal joint. All right, and this joint is primary cartilaginous joint. And then here at the sternal angle there is articulation with the secondary, and from here onward all the lower joints between the ribs and the sternum are the synovial joint. Okay, so these varieties you have to remember. And this one manubriosternal joint, okay, which is also known as the sternal angle. This one is the which joint? This is the secondary cartilaginous joint. And here GP sternal joint. Okay, GP sternal joint, this is gyphoid process, this is sternum. So this GP sternal joint here is the primary cartilaginous joint. Okay, this one is the primary cartilaginous joint. So these are the varieties of the joints here, which are formed in relation to the sternum. Please remember all these varieties of the joints, types of the joints, which are formed by the ribs, clavicle, and the different parts of the sternum. Okay. Now see here, anterior surface of the body presents three faint transverse ridges. Three faint transverse ridges here you can see. This is one ridge, this is another ridge, okay, and here this one is the another ridge. I have drawn the red lines and the place of the ridges. So these are the faint ridges, okay, and these faint ridges separates the four small segments which are fused together to form the body of the sternum. Here you can count. This is one segment, this is another segment, this is another segment, and this one is the last segment of the body of the sternum. And these segments are known as the sternibrae. Okay, these segments are known as the sternibrae. Okay, here it is written, these segments are known as the sternibrae. This is one sternibra, and here this is another sternibra, okay, and this one another sternibra, and this one is another sternibra. Its plural form is the sternibrae. Okay, so there are total 4 sternibrae which are fused together to form the body of the sternum. Okay, and they are separated by the faint ridges. How many ridges are there? 3 ridges are there. And anterior surface on the side gives origin to the pectoralis major muscle. Here anterior surface below the, even it has attachment here in the anterior surface of the manubrium, and it has also attachment here in the anterior surface of the body of the sternum. So there is attachment of the pectoralis major muscle in the anterior surface of the side of the body of the sternum, as well as manubrium of the sternum. And posterior surface of body is smooth and slightly concave, and lower part of the posterior surface gives attachments to the sternocostalis muscle. Okay, there is origin of one muscle from the posterior surface of the body of the sternum. This muscle is the sternocostalis muscle. Remember here one more extra muscle, sternocostalis. Sternocostalis. What is the meaning of this sternocostalis? From the sternum to the rib. Costa means rib. Detail of the rib we will discuss from tomorrow onward. So this muscle will extend from the sternum to the ribs, so that it is known as the sternocostalis muscle. Okay, so it is attached on the which surface? Posterior surface of the body of the sternum. On the right side of the median plane, here you can see now relations, plural relation of the sternum. Okay, deeper to the sternum there lies the pleura. Yes, deeper to the sternum there lies the pleura, and more deeper if you go there lies the pericardium and the heart. Okay, so these are the very vital organs, vital structures here within the chest. Okay, so on the right side of the median plane, right side means this is right side. Here I'm writing right, R for the right side, and L for the left side. Okay, so on the right side, what is mentioned here? The posterior surface of the sternum is related to pleura, okay, which separates it from the lung. So here, this blue line is reflect. See here, this one is the reflection of the right side. In the right side, reflection of the pleura. Okay, so behind the sternum, in the right side, all over the body of the sternum, you can see the pleura. But on the left side, there is slight difference. You can see it. See, till to the level of the fourth rib, till to the level of the fourth rib, behind the sternum, you can see pleura. But from the level of the fourth rib, you can count the ribs. See, this is the second rib. This is second rib. This is third rib, and this one the fourth rib. Okay. So second rib, how I told yesterday, I have taught to you how to count the rib. See, this rib is articulated here at the level of the sternal angle. You can easily identify the sternal angle. Sternal angle is the body of the sternum. So the rib which is articulated with the sternal angle is the second rib. So this is second deviated. Pleura is deviated more towards the left side. Okay, more towards the left side because of the left position. So in the left side, pleura is closely related to the right side. Whole body of the sternum is related to the pleura. In the left side, the pleura related to the fourth costal particles. Okay. After that, it is deviated more towards the lateral side because of the pushing by the heart. Okay. And now lateral border. Come to the lateral border of the body of the sternum. See, this one is the lateral border. Easily you can identify now the lateral border. See here, this side is the two lateral borders. Okay, two lateral borders of the manubrium, two lateral borders of the body. So here, how many ribs are articulated with the lateral border of the body? Now I'm telling to you. See, second costal cartilage articulates at the manubriosternal or at the sternal angle, and then there is articulation of the third rib below this. Okay, then there is articulation of the fourth rib below the third. Then there is articulation of the fifth rib below the fourth. Okay, then articulation of the sixth rib below the fifth. Okay, then articulation of the seventh rib below the sixth. So till to the seventh ribs, second to seventh ribs are articulated to the body of the sternum. Okay, half part of the second and then full part of the third, fourth, fifth, sixth, and seventh. These ribs are articulated to the lateral border of the sternum. You can very clearly see in these diagrams. In this also you can count. This is first rib. First rib is articulated to the manubrium. Then this one is the second rib. Okay, second rib is articulated at the triangle. It means it is articulated. Upper part is articulated with the manubrium, and lower part is articulated with the body of the sternum. And then what is this one? Third rib articulated with the body of the sternum. Fourth rib articulated with the body of the sternum. Fifth rib articulated with the body of the sternum. This is sixth rib. It will also articulate with the body of the sternum. And this one is the seventh rib. Seventh rib also articulated with the body of the sternum. But here you have to also understand or note down the seventh rib articulates at the GP sternal junction. Okay, GP sternal junction. It means it is also related to the xiphoid process. Okay, so altogether, sternum provides articulation to the seven ribs directly. Okay, see here, first rib articulates directly with the sternum. Second rib, third rib, fourth rib, fifth rib, and seventh rib. Till here, the ribs are articulated directly with the sternum. Okay. Other ribs like 8th ribs, 9th ribs, 10th ribs, they are also articulated with the sternum, but indirectly. They will form the costal margin. See here, this one is the 7th rib, and this one is 8th rib, and this is 9th, and this one is 10th. These costal cartilages of these lower ribs means 8th, 9th, and 10th hairs here. Okay, this will form a structure here. This is known as the costal margin, and this will go and articulate with the 7th rib. With the help of the 7th rib. These ribs also related to the sternum, but directly to the seventh ribs, the ribs are articulating with the sternum. After this, come to the Giffard process briefly. And Giffard process, it is the lowest and smallest part of the sternum. Here you can see the smallest part of the sternum is the Giffard process. See, this one is the Giffard process. The lowest and smallest part of the sternum is the Giffard process. It varies greatly in size and shape. Okay, it is not constant in shape and size. It varies greatly. It may be bifid or perforated. Bifid means here you can see. Oh yeah, no. I haven't bifid process. See, I'll draw here. Some of the Giffard processes are pointed like this. Okay, unifid you can say, and some are bifid like this. They will diverge the lower part of the Giffard process will diverge like this. Okay, so this is known as the bifid Giffard process. And in some of the Giffard process, you can see perforation. Okay, like this. There is a hole in some of the Giffard process. Okay, so this is known as the perforated Giffard process. Okay, and the point C, some of the Giffard process will come outward. Okay, will project outward, and some of the Giffard process will go inward also. Okay, and towards the left side, these varieties also you will find. Okay, so here you can understand there are varieties of the Giffard process. There are variety of the Giffard process: unifid, bifid, perforated, pointed. Okay, everted, inverted. Okay, dextro-rotated. Also, you can say lever-rotated, going towards the left side, right side. These varieties are also there. Okay. And now, anterior surface of the Giffard process provides insertion to the medial fibers of the rectus abdominis. So here you can find attachments of the medial fibers of the rectus abdominis muscle. Rectus abdominis muscle is a flat muscle of the anterior abdominal wall. Some of the fibers of the rectus abdominis muscle will attach here. Now, the entire fiber, some of the fibers will attach here onto the anterior surface of the Giffard process. Okay. So which muscle here you have to remember? Rectus abdominis. Rectus abdominis. Here you have to remember this is attachment or special feature of the Giffard process. And if you see or look into the posterior surface of the Giffard process, there you can find the attachment of the external fibers of the diaphragm. So here you have to also remember the diaphragm. Few fibers of the diaphragm origin from the posterior surface of the Giffard process. Okay, few fibers of the diaphragm origin from the posterior surface. From here, this is the posterior part of the Giffard process where you are seeing in this diagram. See, this is the posterior part, and this one is the anterior part. Okay, from here there will be the origin of the diaphragm, and from here there will be the origin of the which muscle? Rectus abdominis muscle. And tip of the Giffard process provides attachment to the upper end of the linea alba. Linea alba is a straight line in the anterior abdominal wall. Okay, this extends from the Giffard process to the pubic symphysis and separates the two parts of the rectus sheath. Okay, so detail of this linea alba we'll discuss in the third semester. Today, just have to remember here, it's a aponeurotic line formed by the interlacing of the aponeurotic. So this is attached here onto the tip of the Giffard process and extends downward towards the pubic symphysis. Okay, so this attachment also you have to know, linea alba. So these are the structures here which are attached onto the anterior posterior surface and onto the tip of the Giffard process. Is there any difficulty till here? You can ask to me now. If you find any difficulty, you can ask. Any difficulty? No difficulty. Then see, I'll now show you the bone, and again same thing. I'll repeat here onto the bone so that you'll find it easier. So can you see the bone today clearly? Some of you please reply to me. Can you see the bone?
Yes, sir.
Yes, sir.
Okay, is the view is clear than yesterday?
Yes, sir.
Okay, okay, good then. So I'll show you this rib, okay, and then sorry, not rib, this sternum, this bone, and then we'll go into the further discussion. So here, this is the manubrium, and this one is the body of the sternum, and this one is the white process. Okay, this part yesterday we have discussed in detail, and today I'm showing you the parts of this body of the sternum. So this one is the body of the sternum. I told you before, upper part of the body of the sternum is narrower than the lower part of the body of the sternum. Here you can see. I'm showing you the two bones. See here, one is more darker than this one. Okay, so this one is the upper part. This one is the lower part of the body. Okay, see here, this is narrower in the upper part, and in the lower part it is broader. Here also you can see this is narrower in the upper part, and lower part it is broader. Okay, and after this I'm showing to you the lateral border. See here, this one is the lateral border. This one is the lateral border of the sternum. Here in the lateral border of the sternum, you can see facets. Okay, you can see facet. On small facet, you can see at the level of the sternal angle. See, this one is the sternal angle. This one is the sternal angle. Here, if you see laterally at the level of the sternal angle, you can see in the body demifacet, and in the manubrium and the demifacet you can see. And these two demifacets, demi means half. Okay, in the manubrium you can see half facet, and in the body you can see half facet. These two half facets combine together to form a single facet, and this facet will give articulation to the rib. Okay, second rib will articulate the lines. Okay, there will be articulation of this. This is not the second rib. Actually, I have to call it like this in anatomical position. This is the typical rib, but here how they are articulating, I'm just showing to you. Second rib will articulate here like this. Okay, the bony part will not articulate. The post cartilaginous part of the rib will articulate here. Here in this rib you cannot see cartilaginous part. Whatever detailed discussion about the rib will do later. Okay, the cartilaginous part of the rib will articulate here in this facet. Similarly, this is another facet here. This is another facet here. Okay, this is the facet for the third rib. Here you can count. This is another facet here. This is facet for the fourth rib. Okay, and this is another facet here. This is facet for the which rib? After fourth, which will come?
Fifth.
Which will come? Fifth rib. Very good. This is facet for the fifth rib, and this is facet for the sixth rib, and this is facet for the seventh rib. Okay, see the seventh rib will articulate here at the junction between the body of the sternum and the gyphoid process. So this junction, this joint is known as the gyphisternal joint. So here there will be articulation of the seventh rib. So altogether, directly there are articulation of the seven ribs in the sternum. Okay, 1.5 rib in the manubrium, and remaining how many? You can say 5.5 rib. Okay, in the body. Okay, here first rib there is see here, this is facet for the first rib. This is facet for the first rib in the lateral border of the manubrium, and then here second rib, here third rib, here there is fourth rib, and here there is fifth rib. This is for the sixth rib, and this is for the seventh rib. Okay, so altogether 7 ribs directly articulate to the sternum. All right. And I have talked about the attachment also. See, anterior surface of the manubrium and the body of the sternum provides origin to the pectoralis major muscle. From here there is origin of the pectoralis major muscle. Sternal fibers of the pectoralis major. Okay, and here this is the gyphoid process. Okay, this is the gyphoid process. This is unifit type of the gyphoid process. Here there is attachment of the which muscle? Rectus abdominis. Yes, good. You are right. There is attachment of the rectus abdominis muscle. Okay, And posterior surface of this body of the sternum will provide attachment to the sternocostalis. Okay, and posterior surface of the xiphoid process, this will provide attachment to the diaphragm, origin of the diaphragm. Okay, and here at the tip of the linea alba, there is attachment of the at the tip of the xiphoid process, there is attachment of the linea alba. Okay, and here yesterday I have mentioned even the posterior surface of the manubrium, there is attachment of the upper part. Which muscle is attached? Can you tell? The upper part, which muscle is attached? Yesterday I have
Sternohyoid.
Sternohyoid.
good. Yes, sternohyoid. There is attachment of the sternohyoid, and in the lower part there is attachment of the sternothyroid.
Sternothyroid.
Yes, very good. There is attachment of the sternothyroid. So in this way, muscles are attaching here onto the different parts of the sternum, manubrium body, and xiphoid process. Okay. Same thing here. It is summarized for your examination. You can read this note. Okay, which I have already mentioned to you. Anterior surface, you can see. Anterior surface, one more muscle is left to mention in the manubrium. Okay, just below the upper border, there is attachment of the sternal head of the sternocleidomastoid. Here there is attachment of the sternal head of the sternocleidomastoid, and inferior to this there is attachment of the pectoralis major. Okay, and it will extend till to the downside. Sternohyoid attachment, sternothyroid attachments. Here in the diagram, very clearly you can see this is sternohyoid, this is sternothyroid. Okay, and even here you can see the relation of the posterior surface of the body of the sternum with the pleura. See here in the right side what I have told to you. Entire part of the body of the sternum in the midline is related to the pleura. See here, this is on the right side. This is right side. Okay, and this is the left side. In the left side till to the fourth costal cartilage, body of the sternum is related to the pleura. Okay, because from the fourth costal cartilage, pleura is deviated more towards the left side because of pushing by the heart. Heart lies there in the left side of our body. The detail about the heart we'll discuss later in the cardiovascular system. Today very briefly I am telling you about the position of the heart. Okay, and then see, you can see the attachment of the sternocostalis. See, this is the attachment of the sternocostalis. And then in the xiphoid process, you can see the attachment of the diaphragm. Okay, this one is the attachment of the diaphragm. So these are the special features about the sternum. And now come to know some of the other features about the sternal angle, which is very, very important. Before also I have highlighted to you, sternal angle is very, very important angle here in the sternum. So this one is the sternal angle. Which rib is articulated there into the sternal angle?
Second.
Very good, second. Very good. So if you are very, very prompt, you are answering very, very correctly. See here, this one is the first rib, this one is the second rib, this one is the third rib. Here you can very clearly see in this diagram. Second rib articulates there with the sternal angle. Okay, and here at the level of the sternal angle, you can see many interesting features, anatomical features, which are very, very important. To know for the clinical practices. So these things I'm telling now. So sternal angle can be felt as a transverse ridge on the sternum about 5 cm below the suprasternal nodes. What is suprasternal nodes? See, this node is the suprasternal nodes. This one I'm showing you. This one is the suprasternal nodes. This one is the suprasternal nodes. Okay, this one is the nodes. I can even palpate my suprasternal nodes. See here, it is at the root of the neck. See here, this one is the suprasternal node. At the root of the neck, there is some depressed area. I ask you also to palpate it. Have you palpated? Yesterday I have asked you to palpate it, to feel it, to find out it in your own body. Have you palpated, some of you? If you are not still palpated, please palpate it, find out it. It is superficially placed, easily approachable, you can easily find out it. How to go here, I am showing to you. See here, this is the sternum, okay, or this is the midline, there is a depressed area. Just feel there, you'll find a bone. Okay, this is the upper border of the manubrium. And this is the jugular nose or the supraesternal nose. Jugular nose or the supraesternal nose. Okay, some of the structures are lying there. Detail about these structures we'll discuss later in the gross anatomy. Okay, so see, it lies 5 centimeters below the supraesternal nose. Sometimes you may not find transverse ridge. This transverse ridge, how it is formed, the transverse ridge, this also a little bit I want to talk here. See, during the respiration, we are doing the respiration every moment, isn't it? Inspiration, expiration is going on till the life will remain there in our body. Okay, so during the respiration movement, the body of the sternum will be elevated upward, okay, and depressed downward. One time it will go upward, during inspiration it will go upward, and during expiration it will go downward. Okay, only the body, not the manubrium. So this body is moving, so that because of this respiratory movement, there is formation of one joint here. This is the manubrio-sternal joint, and because of this continuous movement, there is formation of this transverse ridge. Okay, there is formation of this transverse ridge. All right. So this is produced by the movements of the body of the sternum, and the body of the sternum is moving because of the movement of the ribs. Okay, because of the movement of the ribs during the which time respiration. During the inspiration, it will go upward and forward, and during the expiration, it will go downward and backward. The detail about the respiratory movements will do later. Okay, we'll discuss every detail of the respiratory movement. But today, just to know how the transverse ridge is formed at the sternal angle, this point I have told to you. Okay, and here there will be there is the articulation of the which costal cartilage, second costal cartilage. You can also say second rib. Okay, costal cartilage it is told because anterior end of the rib is formed of cartilage. Here you can see in the diagram the green part is the cartilage, and this will never ossify. Till the end of the life, this part will remain as the cartilage. This will never ossify. Okay, so rib will consist of the cartilaginous part and the bony part. So this cartilage will articulate here to the sternum, and this cartilage we are taking as rib. Okay, so we can also say second rib, third rib, fourth rib, fifth rib, sixth, seventh ribs will articulate there. Okay, to the sternum, and it lies at the level of the intervertebral discs between the T4 and T5 vertebra. So this lies at the level of the intervertebral discs between the T4 and T5 vertebra. This you can see here. So in this diagram, this is the cadaveric diagram. This is the sternal angle, and this is the white part, intervertebral disc between the T4 and T5. This is the intervertebral disc in between the T4 and T5. So sternal angle lies at the level of the lower border of T4. You can say, okay, at the level of the lower border of T4. And we can imagine a horizontal plane at this level. Okay, this is the horizontal plane at this level. At this level means at the level of this transthoracic plane. This plane is known as the transthoracic plane, and this plane divides the mediastinum. Detail about the mediastinum we'll discuss later, into the superior mediastinum and the inferior mediastinum. Okay. And another point is, see, this is the aorta. This is the aorta. Okay, this is the ascending aorta. Ascending aorta becomes arch of aorta at this level. Okay, see, at this level, the ascending aorta becomes arch of aorta, and this arch of aorta will bend downward again, and it becomes descending thoracic aorta at the same level. Okay, it becomes descending thoracic aorta at the same level. So you can now say the part of the aorta which lies superior to the transthoracic plane or the sternal angle level is the arch of aorta. Okay, is the arch of aorta. Detail about the arch of aorta again we will discuss later. Do not worry here at this point. Just know the name of the structure now. Okay, detail about the arch of aorta, everything, whatever name I am telling today here, correlating with the external angle. We'll discuss in detail in later days, in coming days. Okay. After this, come to here, trachea. This is the trachea. Trachea bifurcates at this level. See here, trachea divides into the two bronchi at this level. And the point is about the pulmonary trunk. Pulmonary trunk also divides into two arteries at this level. Okay, right pulmonary artery and the left pulmonary artery. Two pulmonary arteries are formed from the pulmonary trunk at this level. Okay, and upper border of the heart lies at this level. Upper border of the heart lies at this level. Here you can see this one is the heart. Okay, upper border of the heart lies at this level. And there is one vein named the azygous vein. About this vein also we'll discuss after a few days in detail. This azygous vein will arch over the root of the right lung to drain into the superior vena cava. Okay, and this event is also occurring at this level. Okay, this event is also occurring at this level. So there are several anatomical events which are occurring at this level. Very interesting level. External angle or the transthoracic plane or the T4, lower border of the T4 vertebra. It is very important anatomical level. Again, because so many events like the events happening in our life, here also so many events at this level are happening. Okay, so all these events you have to remember, very important events. Okay. With this, I have completed the anatomical part. Now we'll go into the clinical part related to the sternum. So sternum we can utilize for the sternal puncture. Again, see here in the diagram, you can see sternal puncture procedure is going on, and it is doing for the aspiration of the bone marrow for the pathological examination. Okay, and here the special care must be given while doing the sternal puncture. The sternal puncture should be done in the upper part of the manubrium. Should be done from the upper part of the manubrium. Okay, should be done from the upper part of the manubrium. Why not from the lower part? Because deeper to the lower part of the manubrium there lies the very important structure. This is the arch of the aorta, and if the needle accidentally pierce the thickness of the manubrium, even the posterior table of the manubrium, and then it will prick the arch of the aorta, and there will be the hemorrhage from the arch of the aorta, and this hemorrhage even may be the fatal, because arch of the aorta is a very large blood vessel, and the blood is rushing in a great speed there in the arch of the aorta, and even in the other parts of the aorta also. But yeah, I'm telling arch of the aorta because manubrium is related to the arch of the aorta. Okay, so here what you have to remember for the sternal puncture to aspirate the bone marrow for the pathological examination, which part should select? Upper part of the manubrium. And already I have told you manubrium is a flat bone, or the sternum is the flat bone. Outside there is outer table, inside there is inner table, in between there is the hematopoietic tissue or the spongy bone. Okay, and this needle which is passing from the outer table of the manubrium will reach here into the spongy part of the bone, or the cancellous part of the bone, or the hematopoietic tissue, and from here we can take out the hematopoietic tissue or the bone marrow for the pathological examination. Okay. After this, come to here. Sometime we'll do the open thoracic surgery, and this open thoracic surgery can be done with the mid-sternotomy. Okay, to gain access to the mediastinal structure, we can open from the sternum. Okay, we can give incision to the sternum in the middle part, and we can retract the sternum along with the other structures here related to reach there into the deeper part of the sternum, into the mediastinum, and we can approach directly to the heart. See here, this is pericardium. This is pericardium. This is the ascending aorta deeper to this. Okay, and superior to this there is arch of the aorta. Here you can see some veins. So all these structures can be approachable from here. Okay, this is known as the mid-sternotomy, opening of the sternum to reach there into the mediastinum for the surgical procedure. Some abnormal shape or development of the sternum also we can find sometime. This known as the funnel chest or the pectus excavatum, and also the pigeon chest or the pectus carinatum. Okay, what is this funnel chest? See, chest is compressed anteroposteriorly to give shape like the funnel. Funnel, you know, right? Funnel will be like this. See here. Funnel will be like this. See here also. See, chest is compressed anteroposteriorly to give the shape of the chest like the shape of the funnel. So that it is known as the funnel chest. Okay. And this condition, see, sternum is pushed backward by the overgrowth of the ribs. This is happening because of the overgrowing ribs. Okay, because of the overgrowth of the ribs, sternum will be pushing backward, and it may compress the heart and the related structures. Behind the sternum, what is there? There is the pleura, there is the pericardium, there is the heart, there is the great blood vessels which are draining there into the heart, like superior vena cava, inferior vena cava, ascending aorta, arch of the aorta. Okay. And then branches from the arch of the aorta. All these things are lying there deeper to the sternum. So these structures may be compressed if there is more backward pushing of the sternum because of the more overgrowing of the ribs. This condition is known as funnel chest or pectus excavatum. Okay, and another one is the pigeon chest. What is the meaning of pigeon chest? Chest of the person similar to the pigeon. Have you seen the pigeon? Here in the hostel, so many pigeons are there. After you will return, you can get the opportunities to see the pigeons there in boys hostel also, girls hostel also. Lots of pigeons are flying. I'm seeing every day all these pigeons because my house is in between these three hostels. You must have seen my house also, isn't it? So every day I'm seeing the flying views of these pigeons. Okay, and obviously I'm also seeing the chest of the pigeon. The chest of the pigeon is like this, very small chest, and then it is projected forward. Okay, it is projected forward like this. This is because see, chest is compressed from side to side. Here, chest is compressed from side to side. Chest, narrow chest. Okay, it is compressed from side to side. So anterior part is projected forward. In the before case, funnel chest is compressed anteroposteriorly. Here, chest is compressed side to side. Okay, this condition is known as the pigeon chest. And here, sternum project forward and downward like a keel of a boat. What is the keel of a boat? See here, this is the boat. Okay, this is a boat, and here this part is known as the keel. Yes, here also it is projecting the chest or the sternum. Sternum is also projecting like the keel of a boat. Okay, so this is the pigeon chest or the pectus carinatum. Sternal fracture also will happen sometime in the automobile accidents or the road traffic accidents. Okay, so when the driver chest is hit against the steering wheel, the sternum is often fractured at the sternal angle. There will be fracture at the sternal angle, and because of this fracture, the backward displacement of the fractured fragment may damage the larger blood vessels and the heart and even the liver. Okay, and may cause the severe bleeding, which may even fatal. See here. Here you can see the X-rays showing the fracture of the sternum at the sternal angle. So here there is fracture at the level of the sternal angle. Superiorly you can see manubrium, and inferiorly here you can see body of the sternum. Manubrium is going backward and body of the sternum is going forward. See here, this is body of the sternum and this is the manubrium. And deeper to the manubrium, yesterday, day before yesterday, while teaching the manubrium, I have told you there are lying the very, very important vital blood vessels. Okay, I have told you there is the brachiocephalic vein, the one which is going to the left side, and deeper to this there is the brachiocephalic trunk, which is originated from the arch of the aorta, and also the left common carotid artery, left subclavian artery. Okay, these are lying there deeper to the manubrium, and if the manubrium comes a little bit lower, then it may also reach or get tear the this one pericardium, and even may compress the heart. So it may damage such vital structures, and because of direct damaging of these vital structures, there may be even loss of the life in this condition. Okay, sternal fracture. So after this, come to the ossification of the sternum. Sternum develops from the two vertical cartilaginous plates. Very interesting here. It develops from the two vertical cartilaginous plates. Okay, like this you have to imagine it first. There is one vertical plate and another vertical plate here, like this. All right, in the beginning, and sternum ossified from the 6 double center. Here there will be one double center for the manubrium. Okay, and here you can see 4 double center for the what body of the sternum, and similarly here you can see center for the gyphoid process. Okay, so there are the 6 double centers, one for the manubrium. This will count 1. Okay, this yes, and the 2 second, this is 3rd, this is 4th. Okay, this is 5th, and this one is 6th. Okay, and 4 for the body, 1 for the gyphoid process. Later what will happen, here you can see first of all the ossification center, then we'll go into the fusion part. Ossification centers appear in the descending order for the different parts of the sternum as follows. For the manubrium, it appears in the 5th month. For the body, for the first sternivary, it appears on the 6th month. For the second sternivary, already I have introduced to you what is sternivary. If you are still not getting it, you can see here in the diagram. This is the first sternivary for the body, this is second sternivary, this is third sternivary, this is the 14th sternivary. For the first sternivary, the ossification center will appear on the 6th month, for the second, 7th month, for the third, 8th month, for the fourth, 9th month, and for the gyphoid process, it will appear in the 3rd year after the birth. Okay, it will appear in the 3rd year after the birth. And now see, the fusion should occur. If there is no fusion of this ossification center, then while doing the X-ray, then you will confuse and say there are many fractures in the sternum. Okay, because no fusion. So this different sternivary are fused now. Different 2 plates are fused now to form the single sternum. Okay, so fusion between the sternal plate takes place from below upward. See, the fusion is taking place from below upward. Centers are appearing from above downward in sequence. Okay, it begins at the puberty and completed by 25 years. The fusion of all the parts is completed by 25 years. But see, the sternal angle or the mandibulo-sternal junction is not fused. Okay, it is remaining throughout the life. Okay, so it is mentioned as the secondary cartilaginous joint. Which one I am talking? Yeah, I am talking. This will not fuse. This will remain throughout the life. Rest of the parts will fuse. Okay, the gyphoid process will fuse with the body at the age of the 40 years. And this also 40 years here you have to remember. Rest of the part will fuse by the age of the 25 years. Okay, and sometime there will be sternal foramen and the cleft sternum. If there is failure of the fusion in some part, then you can see sternal foramen. Okay, you can see sternal foramen. See here in the sternum there is the foramen. This is because of the failure of the fusion of the 2 sternivary and the 2 plates at this point. Okay, and here also in the gyphoid process you can see foramen because of the failure of the fusion of the 2 parts of the 2 plates, which already I have told you. And this sternal foramen is sometimes associated with the ectopia cordis. Ectopia cordis means the heart will come outside from the chest wall. Okay, in this condition. Okay, so this one is the sternal foramen. After this, yes, I have completed all the parts which I have to cover in the sternum. Still a few minutes I have left. If you have any questions now, you can ask, and then we'll go into the assignment part. This assignment part I'll not discuss. You have to write the answer and send to me. But these things I'll upload in the your this one anatomy. What is there? Separate teams is there for the for writing the answer, isn't it? For your test and etc. There I'll upload, and then there you can click the answers, so it will be easier to you as well as to me also for the correction. Okay, then you can write, and this is for your record. And if you read all these things, okay, and same thing we may be asking in the sessional examination, same thing we may be sending to the university uh, for the university examinations. So these things you have to practice again and again. This is the home assignment. You have to do this, and then now you can ask. Any questions, please? If you do not have any questions, then I'll ask. Do not go anywhere. I have not still downloaded the attendance. I'll download the attendance now, and then we'll start the discussion. Okay. Okay. Any questions you have, you can ask, please.
Sir,
Yes, please.
so can you please explain the fusion part again?
Okay. Okay. Fusion part again. All right. So what I told to you, see, this is, regarding the ossification of the sternum here, you have to understand it first. See, first of all, there are the two cartilaginous plate. Okay, two vertical cartilaginous plate. See here, this is one plate. Okay, this is one plate, and this is another plate. This is one plate, and this is another plate. Okay, and here, see, in this plate there are appearance of the ossification center. Okay, total 6 ossification center in each plate you will find out. See, this is one, this and the, this and the, this and the, this and the, and this and the. Okay, and these ossification centers, now from these centers it will start to ossify. Okay, from this center it will start to ossify. The cartilage should be now converted into the bone. This is known as the ossification, isn't it? Ossification
Yes,
center means from where the ossification begins in the cartilaginous model is known as the ossification center. Every bone, every cartilaginous bone in the beginning, okay, are cartilaginous model. So in this cartilaginous model there will be beginning of the ossification. This beginning point of the ossification is known as the ossification center. They may be primary ossification center, secondary ossification center. Detail about this thing already we have discussed. So similarly here there will be appearance of the ossification center in the upper part, here also, and here also, and here also. Okay, these ossification centers are now separated by the cartilage. Here there is another cartilage, here there is another cartilage. Okay, and now see, all these things should fuse together. This plate should come and fuse with this plate, isn't it? If these plates are not fused, then what will happen? If the upper part only fused, here only fused, okay, and this part also fused, but here in this part, if there is not fused, then what will happen? What will happen? There will be the remaining of the foramen. Okay, there will be the remaining of the foramen. Already I have to show to you. This foramen is known as the external foramen. Okay, this foramen known as the external foramen, and see, everything should fuse together. Even see this manubrial part. Okay, everywhere there should be fused, and the complete fusion occurs everywhere except here. Okay, what is this point? This is the external angle or manubrio external junction. Okay, yeah, manubrio external joint. Okay, some cartilage will remain here in the entire life till to the old age. Okay, so here there will be no ossification till to the old age, but rest of the part there will be ossification. Okay, complete ossification and fusion of these all these segments. Okay, separate segments, and then these two plates. If failure of the fusion, then there will be remaining of the external foramen. Okay, and this may be related with the ectopia cordis. This also already have told you. Any other doubts? No,
No,
the
sir.
dark.
Thank you,
Okay.
sir.
Yes, you are welcome. Very good questions you have asked. And I'll pick up some of the guys and ask one or two questions. Then we'll wind up today's class. I'll pick up the, yes, yeah, Aisma Baral. Okay. I'm picking it
Yes,
very
sir.
randomly. Aisma, you are Aisma, right? Aisma Baral, yes. A very basic question I'll ask to you. What are the three parts of the sternum? Can you tell?
Manubrium, body, and xiphosis.
Yes, manubrium, body, and xiphoid process. Please tell xiphoid process. It is not xiphoid process. Xiphoid process. Manubrium, body, and the xiphoid process. Very good. And how many ribs directly articulate to the sternum? How many ribs directly articulate to the sternum? Different parts of the sternum.
7.
Seven ribs. Okay, the beginning seven ribs. First, second, third, fourth, fifth, sixth, and seventh ribs directly articulate to the sternum. Very good. Okay, this is a good answer you have given. Then I'll pick up the other guy and then test to him or her also. Rahul, are you there? Rahul Gautam.
Yes, sir.
Okay, are you ready for a few questions? Very basic questions I'll ask. Okay. Here, yes. Here you can say yes. What is the vertebral level of the sternal angle?
Lower border of
Vertebral
the
level of,
T-bone.
very good. Lower border of the T-bone. Vertebral level of the sternal angle is lower border of the T-bone. Very good. Okay, class. Now your time up. Okay. Thanks for listening to me in today's class. So with this, we have completed the sternum. So tomorrow onward, we'll start discussing the ribs. This much for today. Thank you, class.
Thank you, sir.
Thank you, sir.
You all are welcome. You all are welcome.